last presentation, maybe not previously, my colleague from Portugal, she described lots of dots. And 3 years ago, we decided that we need the new logo. We need the something common what we are going to do. So what we are doing, we are connecting lots of dots about lots of data about the patient, about their behavior records. So we decided that it should be something routable. And this is our new proposal to our patients, that we connecting all the dots like a planet. Because it's like a DNA, it's millions and millions connections. That's why we are creating the full picture only after we connected lots of the dots in one screen. So my name is Igor. I'm Chief Digital Transformation Officer, and I am also responsible for the e-commerce. In healthcare, it's a little bit strange talking about e-commerce, but as we are commercial, as we are a private group of hospitals, our shareholders like to have more and more profit. So we also try to be like e-commerce or mass platform. Little bit information. We was founded in 1988 when it was like Soviet Union by French shareholders. In more than 30 years, we serve with doctors from Europe, United States, Israel, Asia. So we have a very big background. We presented in Russia, Kazakhstan. Now we work in Saudi Arabia, United Arab Emirates, and partly in Israel, and also Cyprus. And 2 weeks ago, we presented like a small clinic in London. Because after February 24, we need to still increase the profit for the shareholders, but looking for the new markets for us. And as we have a big expertise in oncology, in microsurgery, so we also have a conversation with government of Morocco, because maybe you know, or maybe you doesn't know, the Northern African countries decided to create sort of BRICS, and they ask us to facilitate telemedicine in this region, because it's not enough qualifications of the doctors. Sometimes they doesn't need what to do. That's why they need like a second opinion and telehealth platform. So we are looking forward to provide the health expertise in different markets. So this little bit information about me. Alpha Страхование, it's part of American Insurance Group as it was presented in Russia. So I'm very common with the health industry, because 6 years I work in voluntary medical insurance part of the company. I work in Philips Healthcare, and last 3 years I work in European Medical Center. So when we talked with Patrick, and he asked me, is it really e-commerce in healthcare? And I told him, yeah, it's look like everybody ready to buy anything on the website or an app. And even before COVID start, people more and more come to the website of the clinic, not only to digest the information. They, as we see the cart when we prepare the new website, people, after digesting information about the clinic, they prefer to push in the bottom and to make any sales. directly sales. And when COVID started, we was faced on high demand of telehealth appointments. It was increased 100 times, and nobody ready for it. So for 1 month, we created our own data center because it's not possible use other data centers anymore. So many people need to have a consultation. And when the COVID-19 came, it was a hotline provided by the government, but people waited for hours to get a response. That's why we also decided to make our own call center, our own hotline, to calm down people, because nobody understands what is happening, what is going on, what they need to do. Previously, only our clients could get a telehealth consultation in our app or in our website, and we make it open for everybody. So we make the price of the consultation like just 10 euros, and people could receive any information and even prescriptions, because in 2020 we had lots of psychiatrical patients who was afraid, went out from the house, and it was not possible to get even prescription, because if you need to any pharmaceutical on the psychiatrical diagnosis, you have to come to the hospital and get a paper prescription. So we had an agreement with the government, with pharmaceutical companies, with drugstores, that we will have a guarantee that e-prescriptions that we created will be used only one time and will be like disappeared from the system. That's why the amount of telehealth appointment was increased more than 100 times, and it was very quick decisions in the February and March and April of 2020 to create the really digital ecosystem in a group of hospitals, because we also have like 5 hospitals, and we have private government partnership also in oncology for 3,000 places. So it's huge enough if we are talking about the maintaining of all this stuff. So regarding the data and why we need to collect the data and what we could do with data to make this data profitable for the business. Because if we are a private hospital, we're a business. We have stakeholders which are asked about profit, increasing revenue. So before 2020, we was like a classical hospital. To have an appointment, the patient should call to the call center or come to the clinic by physical way. And during the COVID-19, we increased all digital points with our clients. We created. Yesterday we discussed the WhatsApp, and our stakeholders told me, this is very simple. You need to use WhatsApp. You need to use WhatsApp. Everybody use it. And I told him, okay, maybe in hairdresser or bakery or somewhere else, people just have a phone and use like normal phone with WhatsApp. Would you like to install in all the database one day when managers or doctors disappeared from the clinic? Nobody wanted. So in April, 2020, we signed an agreement with WhatsApp Business. So we created the platform inside the clinic. So everything is saved. And we didn't collect all data in cloud. So we store all data, even from the WhatsApp Business, in our own data center. And this was useful because the call center, sales managers, doctor assistants, sorry, they start use the platform, not their own phones. Yes, they used the very simple and very knowledgeable solution like WhatsApp, but on their PC only, and the company control all the stages from these communications. So this is big line. We created for this here lots of things. Now we have one of the best on the market, I mean healthcare app, because we even have now digital prescriptions inside the web. We have lots of pairs who are not stay in the country, traveling abroad, and they would like to see, like in bank's app, the cash flow, for whom they paid, for what they paid. It was very important for our clients. That's why. And last month, we also maintaining the medical combination. So when the patient sees that one doctor make one treatment and another make another treatment, in app they could see how many hours should left from one treatment to another treatment, not to combine it together. So yeah, we have app, we have online appointment for everybody, even you are not a client of a clinic. But you could make on-demand teleconsultation. It will be free of charge, 50 minutes, and then person who attend in the teleconsultation could decide continue with our company or go somewhere else. So also very important for us part, it's a family account. It's not necessary anymore to make 3, 5, 10 apps for your children, for your parents, for your belongings. Everything could be in your app, and your wife or husband or parents should push a button to provide access to the medical records. If they wouldn't like, they will not provide the medical information, but the owner, a pair, the main pair for everybody, could see the information, just information, doctor visiting and amount was paid. So when 3 years ago, I told the doctors that the teleconsultations could bring more money because for the small period of time they could make more consultations. They told me, no, doesn't work. And it was not, the main question for them was, I don't like to use my own PC at my home. And it's a good point. So we created a special app for the doctors. So it's security, and they doesn't need to use our own PC. And never mind where doctor is, they could chat with the patient. If patient and doctor push the buttons and they make an agreement that they have possibility to chat, and it's better to chat in personal WhatsApp and all data collecting. As yesterday, I show an examples that doctors previously use their own WhatsApp. Lots of picture. Our main surgery came from the Everest Mountain. Oh, Igor, I would like to show you pictures. Oh, no, this is patient. And I told him, it's horrible. And if your child will open it, and this is so many naked photos, just destroy it and start to use our own app. And after 3 Supreme Courts, when the doctors should pay 500,000 euros as a penalty from their own pocket, not from the company, they told me, yes, if we had a conversation inside the ecosystem of the company, we could show that it was or it was not. And in our own WhatsApp or our own calls, it's not possible to do. So now we have like 99% all communications via doctor assistants, doctors inside our own ecosystem. And this is big progress because the company is insured and the doctors also insured. Because sometimes patients have a not very stable mind. That's why better to protect everybody from everybody. So what we developed, we have, I think, like a unique customer-oriented healthcare platform. Not only an app, it's a platform, because inside app or inside our website, the client for 360 degrees covered by the services from the clinic. 24 hours, 7 days a week, 365 a year, all the day, all the time. He could push the button and get any consultations that he need. Because sometimes what we've seen, the patient clear, he or she doesn't know which doctor he need to make a consultation. And so many examples when the patients, clients, customers was not satisfied because they had an appointment with neurology, and neurology told them after 5 minutes, it's not my task, you should go to the cardiology, but pay money for my appointment. So everybody was unhappy, doctors, customers. That's why we created these short 15 minutes consultations, like triage, for better understanding how to navigate the client, how to provide him the best solution for the appointment. And this solution is free of charge if you have a 1-year prescription subscription plan. So so we have a personal physician. So now we have the active customer base, 350,000 people. And we have 85 customers who installed or use the mobile app, because some of our clients still use the Nokia and they don't have a smartphones, and we can't push them buy smartphone, install the app. No, it doesn't work. If person doesn't like to have a smartphone, you can do nothing. So 2 years ago, we also decided that if we created the tailored health plan for each person for 3 or 5 years, like a roadmap, how to protect your health, how to prevent different diseases, it will work. And after we created these plans, now 60% of customers, clients, patients have their own tailored health plans. We see that our NPS grows from 60% to 89%. It's good result because the patient now more happy. They understanding more deeper why do they need that or this appointment or this or that vaccination or treatment, and they are more happy. So we have remote health consultations. As I told previously, we have a special app for the doctors where they could see all medical records in the medical record system, but never mind where they located in clinic or at home, and the patient need a consultation of this doctor because this is his own personal physician and know about this patient a lot. So we also created for the children interactive solutions and gamifications. We started also use the medical vision and regarding the big data, what we use, what IoT we use now. So we started to use tighter care 3 years ago when they just appear. And during the COVID, it was increased demand to buy tighter care, and it was a huge queue for 5 or 6 months and ahead, because our Israeli partners told me, listen, we also have a COVID-19. We have lots of requests from the government. We're just maintaining all this work inside the country. But we bought 500 devices. Before the COVID, we sold 100. And for 1 month, when COVID started, all other 400 devices was sold just in one click. So we also use the cardiologist's T-shirt from the French company Chronolife. Maybe you know, does not. It's help us to see the condition of heart, lungs, oxygen, temperature, and you doesn't need to bring all this stuff. You just need to have only one T-shirt. So we use the OLO, the blood analyzer, which makes the result just in 1 minute for 38 different blood components. And as I told yesterday, we created EMC Connect. It's our data hub. It's only one app for doctor and one app for the client. So if client has Whoop, Lumen, etc., different devices, the client have like 20, 25 or 50 apps in their smartphones, and doctor doesn't get any information to these apps. So we created EMC Connect. It's a data hub which collect all information from Google Health, Apple Health, and all other health devices that clients have. So the client now needs to open just one app and to see all the information about the solutions, health solution with him. The same doctor could also, before the visit, if the visit was planning by the doctor also could have the possibility to look through this data and to make the better treatment. So as I told that we have like 365 clients and we have like 20,000 new clients yearly, and why data could make our profit. So we have like also 7 data scientists and we have 5 product leaders who created the products and the specific products for the customers. I don't like words. I prefer to speak on the language of the figures. So just some figures to 2022 to 2019 before the COVID. So our revenue 3.4 revenue growth with the project. So we started to use the WhatsApp business and we created 56 segments now, and we created and we communicate now with 65 segments. So why we spent 3 years? Because we are not retail. It's not possible. We are not Amazon. It's not possible to recommend the patient that the patient looks like you have this disease, so you also could have it. No, it's we try to make on the same algorithm like all retail units work, and it doesn't work. So we created our own algorithm which recommend people to buy different healthcare solutions, healthcare plans, and we communicate with them via WhatsApp. And we see that we have a revenue increased because these specific treatments for specific customers. In 2019, just 6% of our customer database had a mobile app. Now we have 73%, and it's good because as much customers have a mobile app, as much we could connect directly with the patient. When we started to use WhatsApp Business to communicate with clients, we also increased the revenue for each campaign. So campaign for 5,000 people cost for us 1,250 euros, but the revenue is 98,000. So it's quite profitable, and we still use these solutions to increase the sales. And open rate in 2019 was just 5%. Now we have 37% in open rate in all our communications. With emails, yes, emails not that, with mobile app and with WhatsApp. But in WhatsApp, we know everybody who we send the communication, and our doctor assistant could make a call for the people who not open and propose why they should come to the doctor. And we increase the conversation in sales up to 8%. This is good also for us, because if you know the conversation rate in different industries around 2.5–3%, it should be like a good conversation. And 8% for us, it's a really good result, but we spent more than 3 years to create these solutions. And my main KPI is the NPS, and the NPS showed us that we are on the right way. So the data collecting need to be done, but how to use it is a question of each company, each clinic, because you don't need to collect as much more data as you need. You just need to be focused only 5 to 10 the data reasons, and it will be better solutions and it increase the sales. Thank you. If you have questions, we could discuss it later on the Q&A session. Thank you.